Hey y'all, this is the third Instagram Live, and I'm going to have Dr. Stephanie Zhou. I'm just going to invite her to join. She's at Breaking Bad Debt, which I love the name. Okay, we have some folks joining, and I've asked Stephanie, aka Dr. Zhou, to join. Yeah, so we've started the live. Um, yeah, I hope I'm like really looking forward to this. I remember working with Stephanie when she was, I think, a medical student actually. Um, so hopefully she'll be joining. It's 7 o'clock, so she'll be joining us like just now. Appreciate y'all tuning in. Ah, there she is. And I've already invited her, but let me see. Let me do go live with her. That makes it okay. Ah, there we go.
Hi, everyone. You could hear me all right?
Yes, yes, I can hear you perfectly. I'm realizing I'm probably, yeah, I'm backing up a little bit. Can you come forward a little bit so we like meet like even face,
Sure. Let
if
me
that's a
just
word?
shift my shift my chair forward.
Yeah, and I'm
Okay.
gonna back up. I'm gonna back it up.
Cool.
Although
Is
back
that
it up,
okay?
yeah, that's
Cool.
perfect.
Okay.
That's
I'm
perfect.
just joining from my clinic, so just finished work, so that's why I guess the sound quality could have been better, but that's okay. I'll
No,
just
no, no.
make do. Yeah.
Yeah, no, no. Sound quality is good. This is a live. Doesn't have to be
Okay.
perfect. And yeah, welcome. So I'm gonna like, do my usual intro and give you a proper welcoming with a
Okay.
bio and everything. All right.
Cool.
So, hi everyone. My name is Dr. O, and I'm the host of Health Curing Differently, where we do IG Lives every Tuesday, like this at 7 p.m. Eastern Time. And I interview folks like Dr. Stephanie Zhou, who we have here, who are health caring differently. Also, I want to tell you, please join our newsletter for information on diversity pathway programs into medicine and other fields, scholarships and research opportunities, and mentorship opportunities. So let me do your bio,
Okay.
doctor.
Sure.
So Dr. Stephanie Zhou is a family doctor who practices addiction medicine and is the EDI and Social Accountability Lead at Sunnybrook and the FHO Lead at Donmal's Family Health Team. She is an assistant professor at the University of Toronto, where she teaches the financial literacy curriculum. And Dr. Zhou immigrated to Canada and grew up in subsidized housing, which led to her investing in education and housing initiatives through philanthropy,
Mhm.
which I think is awesome.
Thank
Welcome,
you.
Dr. Zhou.
Yes, happy to be here. This is actually, for as long as I've been on Instagram, this is actually the first time I've done an Instagram live. So it's a great experience to see what that's like.
Yeah, no, it's fun and like people ask questions and then what'll be cool is that we'll like play it in other spaces.
Hmm.
So like if people miss it, they'll have it like later on. So
Cool.
people watch later.
Sounds good.
Yeah. Okay, so like I mean obviously you gave us you sent us the video, but not everybody, about your background and how you're health
Hmm.
caring differently, but not everybody would have watched that. So I want to kind of like start from um a little bit of your origin story. Like, in the bio, I said that you immigrated here, and certainly that's had an impact on how you practice medicine. And
Hmm.
maybe you didn't see it, but on LinkedIn, I was like, there are those of us who might struggle to think outside of the box. But like folks like us, like I grew up lower income as well. Like we were born outside of the box, right?
Hmm.
So we naturally think differently. But do you want to just tell us a little bit about your origin story, particularly into medicine?
Sure, yeah. So just as a gist of it is when my parents and I immigrated to Canada, we settled in an area called Alex Park. This is one of the lower income areas of Toronto. And because we lived in housing that it wasn't exactly that clean. It was, you know, it had mold, it had cockroaches, it had rats in it. It's not exactly great for a child's formative years for their development. So as a
Oh,
result, I had a lot of respiratory illnesses. I also had nutritional deficiencies because food was scarce. So whatever we ate, my dad worked as a dishwasher, so it would be like whatever he like leftovers he took from the restaurant. Or
oh wow.
there were times my mom and I we would go to these like leftover like stuff that was left over at these convenience stores or outside of the grocery stores in the Chinatown area. Like we would just take whatever was left over there because it was free.
Mm.
So that led me to have a lot of nutritional deficiencies as well. And so I was hospitalized quite a lot.
What
And
age were you
I
around
was
this time?
around 4 to 6. Those were kind of the years
Mm.
that we lived in that area.
Yeah.
And so because of how much I was in hospital, I also missed a lot of school. And because my English was not my first language. So the teacher, it was like one teacher to like 30 something kids, and they thought I had a learning disability. So they actually put me in special education classes. And I remember in special education, instead of learning like the alphabet or learning math like the other kids, we played something called pick up sticks. So it's basically this old game. I don't know if people still remember this, but there'll be different colored sticks and they would drop it on the table and you would try to pick up sticks of your color and avoid the like one of the sticks would kind of it's kind of like pool where you would avoid hitting the black ball into the net.
Okay.
You
Okay.
would just not pick up there was like one stick that was like I think it was like the black stick or the red stick. So it was like the purpose of that game was to help people like to teach them how to focus their attention. So it's
Okay.
kind
Because
of
I
like
was
one
like,
of
where is
those
this going? Okay.
yeah.
Okay.
So it's like
Okay.
one of those, I guess, games that help kids be more focused.
Mm.
Maybe it's for kids who experience ADHD, for instance, right?
Right.
And then when my parents were picking me up from school, they realized, oh, how come she's not in the class with the other students? And then that's when
Wait,
the
they didn't even
teacher
tell your parents?
no, they didn't. Yeah. So they just said, oh, you had to go to this class
Oh my
instead. And I
gosh.
didn't know why. So I actually thought it was fun because I'd have to do math. I could just go play like various games, like pick up sticks and
Right.
yeah, those kind of things.
You just be
And
playing all day. You're like, this is
yeah.
cool.
And
This
then my
is
parents
okay.
were like, why is she playing all day and not actually with the rest of the
Wow.
class? And then they realized it's because they put me in the special education class. And then they realized it was something that had to do with the neighborhood because of the neighborhood not being great, the schools were very oversaturated, very under-resourced.
Right. Yeah.
So what we ended up doing as a result was we try to combine resources with another immigrant family, two families renting one apartment. And
Mm.
so that's kind of the way we had to do it to get out of that environment. And then
Right.
I ended up moving to like a middle income, a little bit better environment where it wasn't like when I'm walking home from school, there were syringes on the ground.
Mm.
That it was a different neighborhood from that.
Right.
And that was actually the first time where I started being in the same school as other students who had parents who were maybe like dentists, lawyers,
Hmm.
doctors. And then I would go to their homes to work on group projects and stuff like that.
Right.
And then because I did pretty well in school, like I worked hard, I tried to, like I really saw the struggle that my parents had, not
Yes.
being able to speak English, and then they didn't have university education.
Hmm.
So there were times when um, my mom got fired from work quite a lot, and there were
Mm.
times where she was mistreated at work.
Yeah.
Like her boss would tell her, "Oh, you're really easily replaceable because there's so many people with college degrees who could take your job," because she
Right.
didn't have that. So it made me take my education seriously. I studied hard in the summers, what I would try to do, and this sounds really keen. I probably won't make my kids do this, but like I would go to the library
Hmm.
and I would try to borrow the textbooks from the year above me, and then I would read through them. So that
Yeah.
way it would kind of prepare myself to know all the material
For
for the
the
next year.
next year.
Yeah, I remember I
Yeah.
told someone in my med school class that I did that, and then they were like, I heard about people like you, but I didn't know they existed in real life. But
No, but
like,
I feel like that's often part of the hustle that a
yeah,
lot of us who are the children of immigrants or immigrants ourselves go through. Like, I was telling my girl, because I have kids and they're just like, they're not about that life. They're just more
right.
chill. But
Yeah, like
I
I
used to
would,
give myself
yeah.
spelling bees. I would record
Wow.
it and play it
Okay.
back to myself to give it. So no, no, I'm
Yeah.
with you.
Yeah.
Continue.
I think
Continue.
everyone has their own way, right? But I guess that's what I did because,
You
of
see your
course, my parents couldn't.
parents.
yeah, like they couldn't afford, those kind of prep classes that people do in
Mm,
the summer or summer school
yeah.
or things like that. But at least like library was a free resource, and so I try to go
Mm.
there. It was near my house. And then that's what I try to do to survive, right? It's all about survival and
Survival.
trying to,
Yeah.
make do with what you have that maybe other kids who weren't in your situation, their parents could pay for summer camp and things like that. So that's what I
Yeah.
did. And it's what actually kind of made me do well in school. So as a result, like people kind of knew who in the class were maybe the nerdier ones or maybe who
Yeah.
did well. And sometimes the grades were like posted and who was on the honor roll and stuff like that. So
Hmm.
a lot of times people from the wealthier students in my class, they would seek me out and ask me to tutor them.
Ah.
And so I would often, they would invite me to their house and I would actually go because this was the first time I found out what a pantry was. I had never seen a pantry in my life,
I know.
but some of these people had like a pantry, which is the size of basically like a
Your
bedroom.
house. Yes.
And it was like
Yes.
full of like so many delicious
Yeah.
snacks. And like I really like fruit roll-ups. And then there's like Dunkaroos, which I don't think exist anymore. So I would agree
Yeah.
to tutor them because I got to eat their snacks. And then
No
sometimes their
perks. Yeah.
parents, yeah, and sometimes their parents were like, "Oh, we're ordering food. Do you want it?" I'm like, "Yes,"
Like,
because it would
yes.
be way better than like at whatever I was eating at home.
Right,
So
right.
I was just tutoring all of these kids for the free snacks,
Mm.
and then I was also helping some of the older ones edit their university
Oh,
applications
wow.
and essays.
Wow.
Yeah.
Okay.
So I was in kind of like grade 10, grade 9 at the time,
Hmm.
and there were these people in grade 11, 12, and then I was trying to help them with their essays and things like that.
Right.
Um, because we got the option to take classes that were ahead of our grades. So, for
Mhm.
example, even though I was, let's say, grade 10, I was allowed to take grade 11 and grade 12 math courses,
Yeah, yeah,
as long as you had the
yeah.
prerequisites. So I
Yeah.
did that, and then that's how I got that opportunity. And then that's also kind of how I met people who were in grades above me as well. And I got to
Mm.
realize the stuff that they're applying for. Like they were applying for law, like someone was already doing like a co-op in a law firm in high
Wow.
school.
In high school,
Yeah,
already doing
because
a
he would
co-op.
always wear suits to class. So I was
Damn.
like, oh,
Okay.
okay, this person's really well prepared. And then I knew people were volunteering in hospitals already because they were kind
Mm.
of going the pre-med path and they were applying for life sci and health sci and things like that.
Right, 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 right. Okay,
So that's
okay.
how I found out that health sci as a program existed or life sci existed.
Right. Life
Otherwise,
science, health science,
I had like
right.
no idea those were a thing.
I see people
Yeah.
waving, so I'm like, yes, yes, we are here. People are
Yeah.
coming in and out. I just want to like acknowledge the room because people are waving, and I'm sure they'll have some questions. So people are sending you love and fire.
Oh,
Like
great.
that's been
Okay,
going
sounds
on while you've
good.
been
I see that.
talking.
It's kind of, yeah, it's pretty cool that Instagram has that option.
Yeah,
But yeah, like
yeah.
that's what I did. And
Samira
then,
and Mustafa.
yeah,
So I just want to let you know because we're going to do a whole dynamic thing,
cool.
right? So,
Okay. Yeah.
folks, please do keep your questions in mind because Stephanie is talking about all kinds, or Dr. Zhao is talking about
That's
all kinds
okay.
of really
Yeah.
important stuff around like the way that we grow up differently, and sometimes we experience like stigma about it. Like I did grow up with roaches. I did grow up, you know what I mean, with parents who are maintenance workers. And in when we aspire to medicine, I know a lot of you
Oh, looks
are
like people are saying you're cutting
oh, I'm
out.
cutting
I
out.
just I
Okay.
just saw the screen got a little bit blurrier there when
Oh,
people
okay.
were commenting, but now it looks
Okay.
okay. Yeah.
Yeah, I'm not sure what happened. But, for a lot of folks, sometimes we're like ashamed of what makes us different, but
Hmm.
that is part of what makes us able in any field, including medicine, to bring something different. So Stephanie, I'm gonna kind of like come back to you again. So like these experiences that you're having, how do you feel like they made you more prepared, I guess, for a field like medicine, or how did it make you more determined to be the kind of doctor that you are now?
Yeah. The only reason I ended up choosing medicine instead of like what my classmates were going for, because a lot of them were going for medicine, law, and business. Those were the three
Mhm.
most common. But that's because I didn't really know anyone in law. I didn't know anyone in business. Like some of their parents were CEOs
Right.
or ran their own companies. So I didn't know anyone like that. I wanted to do DECA. DECA was this like business competition that high schoolers
Mhm.
do. And the reason I didn't do it was because it cost $75 and I didn't have $75. So I
Oh,
kind of missed out on those opportunities, but
right.
I knew about medicine.
Mm-hmm.
So because I was in the hospital so much growing up for like respiratory stuff and malnutrition and nutritional deficiencies. So that's how I ended up choosing the medical path. And so the reason I ended up going to Queens was because Queens actually gave it was all purely financial. I didn't know that really the difference between Queens, UofT,
Right, right,
McMaster,
right.
they all seemed the same to
Hmm.
me. I knew I didn't want to choose UofT
Hey,
because I didn't want to
okay.
be so close to my parents. I just wanted to
Uh,
get out and have some freedom and just to see what that university experience was like.
okay, okay.
Um, and so I'm actually really happy I chose Queens because it was a very tight-knit kind of school.
Hmm.
Like the downtown Kingston is not like so far away from like the actual campus itself.
Right, right.
And then also they provided a lot of scholarships. So I just
Okay.
chose the school purely based on whoever gave me the most money and made it the cheapest for me. That's purely the reason
Right.
why. I didn't look
Yeah.
into stats or anything.
Actually, so we've got a
Yeah.
question. So, and I want folks to ask questions. Please
Oh
do
yeah,
ask
I saw
questions to
that
Dr.
question
Zhou.
pop up. Yeah.
So, like, you as somebody who immigrated and also you had a life experience of like being in a lower income situation.
Yeah.
So, you know, Queens is not cheap. Like, what were, I guess, where there's, was it, do you think it was harder for you and how did you overcome that?
Yeah, so Queens gave out scholarships to 36 students, and it was called the Chancellor's Awards.
Okay.
And I don't know if other universities had something like this because I clearly did not see anything like this with other schools.
Hmm.
But they actually had these like full scholarships. They also had scholarships based on like the average grade that you had going in.
Right.
So it was a lot more based on like your grades and stuff. And they just had more grant opportunities. And so that was just why I chose it, basically, right?
Okay.
But for those of you who are applying to university, like I would suggest you check out this website called Scholarships Canada. That's what I use to look up scholarships. And even now, there are like databases. Even at U of T, they have a database where you could search scholarships based on, for example, whether your ethnic background, your low income. There's scholarships for that too. So I try to look at schools that had the most scholarship opportunities as the biggest driver for which university to choose.
I love
Um,
that. I used
yeah,
to I used to actually like scour like the internet looking for like Black community
yeah,
scholarships and I would just like just go after them across the country.
yeah.
That was like
There's even like
pre-med, but
Reddit
like
forums as well.
yeah,
Like there's a Reddit
go get that
pre-med
money.
forum where people talk about this stuff, and I think it's a great resource
Yeah.
because the way I think about it is, so scholarships are tax-free. Like you don't get
Yeah.
taxed on the income you make from
It's like
scholarships.
free money. It's lottery.
Exactly, exactly. Compared to work where you do get
Yeah.
taxed on your
Yeah.
paycheck. And then also you invest like 1 hour, 2 hours writing a scholarship essay, and as a result, you get $1,000. Like even as a doctor, I
Awesome.
don't make $1,000 in 2 hours. So
Yeah. It's
that's
fantastic.
if you can like really stack up all of these smaller scholarships, that
Right. Right.
it really adds up from a
It
financial
does. It
perspective.
does.
Yeah,
And bursaries as well, right? Because scholarships
exactly.
are based on marks, but bursaries can if you're lower income. So speaking of lower income, like you've got this really cool YouTube and you've got the really cool Instagram,
Right.
like Breaking Bad Debt. And I think it's cool that your work focuses, like you do addictions medicine, which
Yeah,
hopefully we'll touch on, but then you do this really cool work around making sure that students, and I'm guessing more it's like more lower income students who come in the way you did or who
right.
I did, have that financial literacy. So tell us a little bit about that and the Canadian Physicians Financial Wellness Conference. Like,
Sure.
let's talk a little bit about that kind
Sure.
of
So let me
work that you're
start
doing.
with Breaking Bad
Yeah.
Debt first. So basically, so how I started doing Breaking Bad Debt was initially I was on Instagram and I was part of this program called Community of Support. And what I was doing with Community Support was I started a webinar for them called Affording Medical School. So it was
Mm,
basically just about, how to pay for medical school, how to afford it. That's essentially what it is.
right.
And then how to kind of get research opportunities because it can be really hard when you don't have the connections. So I gave that webinar to community support students, and something that the community support students told me about was like, like when I get into medical school, I feel it hard to keep up with students who come from higher income backgrounds, especially those who post on Instagram about the newest makeup they bought, the newest purse they bought, or whatever
Mm,
really nice condo that they got, right?
yeah.
And it felt like kind of like keeping up with them can be really hard. At the same time, you also have a pretty large line of credit. Like at the time
Yeah.
for me, it was $250,000 line of credit. And so there's that temptation to use that line of credit on lifestyle spending to try to
Yeah.
fit in with the other students.
Yeah.
And this was like a common thing on Instagram. So then I thought like, okay, why don't I just create the antithesis Instagram to that? So instead of posting about, buying designer stuff, which I actually don't do, I don't own anything designer.
Hmm.
I would post about couponing or about frugality,
Right.
why it's important to save money and paying down debt. Like that's why I called myself Breaking Bad Debt, because I was in student debt. I graduated 100,000 and plus of
Yeah.
debt. Um, and I called it Breaking Bad because I like the show. That's
Right. Right.
basically it. It's a great series and it's also about addictions. So that's why I kind of called it that. Um, but uh, but yeah, so I started doing that. I was posting information about finances, which was
Mm.
pretty unique because I don't think any other medical person I knew was posting about couponing or
Yeah.
using points to travel, things like that, right? The frugality side.
Yeah.
And then what I realized was that at the same time, Affording Medical School seminar was pretty popular with the community support students, and
Okay.
people outside of community support in the class also wanted to learn financial literacy. So
Right.
I made a
Okay.
proposal to the dean's office to kind of put together, how about we do like a bigger curriculum called Affording Medical School, just for like the whole class.
Mm.
But at the time, they didn't really see a need for it because they said, oh, like medical students don't really have trouble affording medical school. They have a line of credit, they can use that.
But that's
And so
not
that was,
affording. That's debt.
I know
Yeah.
exactly, but they thought
Yeah.
because students had access to such
Right.
huge line of credit, they shouldn't have a problem with paying for school. And
Right.
so it required a big culture change. And what actually ended up happening was I approached the person who taught the leader curriculum,
Hmm.
and she basically donated her lecture time to me to give that
Oh.
talk to the whole class.
Okay.
And it was so popular that like students rated it really highly on their evals. And that
Mm.
kind of was the push that the overall, head people needed
Right.
to really have that as a longitudinal curriculum. So now I
That's
partnered with the financial aid office to have the financial aid talks, talk about lines of credit in orientation week. We have a talk
okay.
in first year about budgeting, about debt, and then in second year about investing. And then
Okay.
third
I'm
year,
gonna.
there isn't anything, but
Yeah.
fourth year, debt repayment.
Okay. Okay. Okay.
Yeah.
So I'm wondering. Let's
Hmm.
see. So we didn't touch on addictions medicine yet, and we haven't touched on the
Oh,
financial
yeah.
wellness conference yet.
Yeah.
But there's 8 minutes left, so I'm just gonna check with those in the audience right now. Like, do you folks have questions for Stephanie? Do you have for Dr. Zhou? Do you have questions about the like debt and
I
affording medical school or
saw
anything?
someone had
Somebody had a question.
Lynn Burley
Oh,
had,
that
I hope I'm
was
pronouncing that right.
yeah.
Some people have very creative usernames, but Lynn Burley had a question about whether it was hard to get into medicine as a student who immigrated to Canada. I think the biggest challenge was actually just knowing what to do and how to get started, what courses to even take, because I felt people who had family members in medicine or knew people in medicine had an advantage in that they kind of knew the system. So that's where I found forums to be extremely helpful. Like
Oh, okay.
Pre-Med 101 saved my life. I don't think if Pre-Med 101 existed, I wouldn't have gotten into medical school. And now there's even
Hmm.
Reddit forums. And now there's even like conferences, like pre-med conferences. There's pre-med clubs, which did not exist really when I was a student. And those are all ways where you can really get access to medical students and to people in the field who can give you those insider information. Even like altitude mentoring. I was an altitude mentor for a while. Community of support if you want to get into like
Yes.
UofT related med students, diversity mentorship program. So these really ballooned um,
Yes.
ever since, right?
Well, now there's
Um,
communities of support across the country. So I want
exactly.
people to know that it's not, and we'll have information about that in the newsletter.
Yeah,
It's not just U of T anymore, from BC to like out west, Newfoundland and Nova Scotia. All of these pathway programs have opened
for
up.
sure.
You also have another question coming up, but okay, sorry
Okay.
to
And I'm
interrupt, but I just
happy
want
to
to say it's not
stay,
just U
yeah,
of
I'm
T.
happy to stay longer than the 7:30 cutoff time just to really get your questions answered. But that's basically what really helped me. Oh, and the other thing that really helped me was because I couldn't afford MCAT prep classes, Khan Academy on YouTube So that was actually the whole reason why I chose YouTube as one of my platforms, is because Khan Academy basically saved my life when it comes to undergrad. Like the only reason I did well in high school and in undergrad and I got a good GPA was because I watched Khan Academy. I think Khan
Oh.
Academy on YouTube, sometimes they just teach way better than some of the lectures that I've gone to. And
Oh,
so
and
it
it's
really
free,
helped
right? How
me.
do you spell it
Yeah,
so people know?
Khan, Khan.
Okay,
Khan,
Khan.
Khan
Okay.
Academy. And now
Okay.
they actually have many different channels, like medical channel. Before it was just like a general channel. Like I was one of the
Mm.
very early subscribers to that
Ah.
YouTube channel.
Okay.
And they had like this whole like MCAT review YouTube
Oh
series
my God,
that
that's
I
amazing. And
watched.
it's free, right?
Yeah. And
Oh,
now there's so many of them. Like on YouTube, there's so many of those like MCAT prep courses.
that
It
is so
used to not really be a
cool.
thing, but now a lot
Oh,
of YouTubers are doing like free content like
I
that,
love,
including myself, but in the
okay.
financial space.
I love that. And I think we'll include that actually in our newsletter. That's awesome if people can take free MCAT courses.
Yeah.
Questions are still coming in. So let's go with how do you mitigate? I like to get as many as we can
Yeah.
within the 7:30, just in case people have to go.
Yeah.
So how do you mitigate against wanting to keep up with the Joneses or the
Yeah.
Kardashians, I guess. But yeah.
Exactly. It's definitely tempting, but I think for me, if I because I grew up used to being really frugal, like used to, sticking to a budget, not buying more than expected,
Yeah.
because I've already gotten used to that kind of lifestyle. I was already used to living in an environment where it's multiple people in one room, right? Like I've always
Mm,
had like to be honest, I've never lived by myself. Like I've always just lived with people, and the only time I lived by myself was when I worked as a dawn in residence. That was the only time I had my room to myself.
mm,
But I've always had housemates. Even when I started off as a staff physician, I had housemates, and then now I live with my husband, so I don't
right,
really live
right.
by myself anymore.
So
So
I guess what do you suggest for others who
yeah,
have lived
like
alone or not had that experience?
exactly. So for me, because I have that lived experience, that's kind of how it made it easier for me to not be tempted. But the other thing is, I think about it this way from two equations when it comes to
Okay.
spending. The first is called the Your Life or Your Money. It came from this book, basically called Your Life or Your Money by Vicki Robin. And what she's saying is that all of the hours in your life has a cost to it. And you have to decide when you buy something, when you spend on something, how much of your life are you giving up for that? So let's say if you're making like $15 an hour and your classmates are going on this like $1,000 vacation, how much of your life are you exchanging for that? Sometimes it can be hard to
Mm,
think about it that way as a student because you might not actually be making any money per hour. It's easier
mm,
to think about it as a doctor where you're getting paid
yeah.
fee for service, right? But the other equation I came up with, I don't know if it actually, I'll just call it Dr. Steph's spending equation. But basically, how I think about it is I think about how much something costs divided by how many hours I would use that item for, or slash years, months, hour I would
Right.
use that money for, that item for. So it doesn't mean that you can't buy expensive things at all. Like my laptop is an expensive thing that I bought, but
Right.
I've used my laptop for 8 years. It's got me through all of those like course, you have to try to sign up for the course or sign up for the elective
Mm,
like as soon as possible. So it's fast. But yeah, it was expensive. But when you distill it down to the hourly cost of use, it's probably like several cents per hour,
right.
which
Right.
makes
Like
it
it's a
worth
good
it.
investment, return on investment
Exactly,
kind of thing.
exactly. So that's kind of how
Okay.
I think about things. Like you decide for yourself what is your hourly cost of use for anything you want to buy,
Mm,
including vacations, designer stuff, or whatever spending temptation you have.
yeah.
And for me, I've decided for myself that I think if something costs me $1 an hour of use, that's actually pretty worth it. But for example, if someone wants to buy some Louboutins, which is like $1,000, but you can't you when you wear them, it's like very painful to wear. These are like these really high heeled shoes for the
Yes.
women.
Yes.
Some women like them.
Yes.
But a lot of times, like you just wear them for like 2 hours, and then they're so painful that you just leave them on the floor and you
Yeah.
don't wear
Yeah.
them. Like it's not a good use of my money because it's basically like $350 per hour to wear these shoes. So that's why
I
I,
love
I
that.
don't buy that. So
350.
that's
Right.
that's
But
literally
it
how
depends
I
on the person, right? It
yeah.
depends on your values. Like for some people, maybe those Louis Vuitton shoes get them like the kind of date that they're looking for, and that's a bigger
Yeah.
investment for their future.
Like
But
trying to secure the
everybody's
bag.
different.
Yeah. Exactly. But I guess
Everybody's
that's kind
different.
of
Everybody's
how
different.
like my
Yeah.
mindset
No,
is when I
that's
try
cool.
to think
That's cool.
about spending,
Yeah.
right?
Uh,
Yeah, because
and
yeah.
mm, no,
Sorry,
it's
go
really
ahead.
about
Go ahead.
breaking it down. And so, okay, I want us, we're past the 7:29. If folks have questions, please put in the questions. I'm hoping we can touch on two more things and hopefully we'll have a couple more
Yeah.
questions. So, the Canadian Physicians Financial Wellness Conference. I want to touch on that because like these kind of tips you're giving, like, is that part of the conference? And
Yeah.
one thing that I want people to know, because it's going to be recorded, is what I love is that you're teaching financial literacy to physicians and medical learners, right, who might have come from lower income backgrounds,
Hmm.
but then the proceeds go to community and lower income communities. Because I think
Yes.
people are like, oh, boohoo, poor doctors. But this is not just about boohoo, poor doctors. It's meta because it's teaching doctors financial literacy and trainees and students, and then the proceeds are
Uh,
going to
yeah.
back into society or community. So I
Yeah,
think that's
so the
beautiful.
Canadian Physicians Financial Wellness Conference, I started it 3 years ago, and to make it conflict of interest free, I just donate the proceeds. And in the first year, we donated it to Habitat for Humanity. And then after that, I decided, okay, how do I make this money go last further? So instead, we used the proceeds in the second year and beyond to create an endowment fund at U of T called the Equity Award. And the reason we call it the Equity Award is because equity, it means basically like equity stocks, right?
Mm-hmm.
It's a form of investment,
Oh, okay, okay.
but
So think about
equity,
justice and equity. Okay,
exactly,
okay.
equity also has another meaning, which is
Yeah.
fairness, right? Trying to level the playing field for those who, can't afford medical school or has
Mm-hmm.
a hard time affording medical school. Because working in the financial aid office, I do see students who have 200,000 in debt, and they're only in second year of medical school,
Oh
and they're
my
200,000 in debt,
gosh.
right? Because of maybe family reasons,
Right.
parents
Yeah.
lost their job, they're losing their house, whatever reasons, right?
Mm.
So
Yes.
I want to be able to help students who have financial need, but
Mm.
also so this is not just the financial need award. It's a student with financial need who uplifts others
Oh,
with high financial need. So either these students are getting involved in financial literacy initiatives. Some of them
right.
started like a UofT Business and Medicine Club.
Oh.
Some of them are actually working on something called Price of a Dream, right? So Price of a
Mm-hmm.
Dream is a program to really try to reduce costs of the MCAT,
Yes.
of the OMSAS application process. So those are all things that students are doing to help uplift other
Yeah.
students with low income. And so I want to be able to reward students who really take that time out of their busy schedules to really try to support other students who have low income backgrounds as well. So that's
Okay.
why it's called the Equity Award, and students can apply for it in their fourth year, and then they get that award as part of their convocation
Okay.
in
Well,
fourth
that's a
year at
beautiful
UofT.
like circle of, you
Yeah,
know what I mean, support. And I mean, we'll have to talk offline because I think there's a lot of synergy between health caring differently and how we're trying to outreach to diverse students from,
yeah,
um, uh, who have been born outside of the box, like you and I were born outside of the box. So we'll talk offline because I'm really curious about how we might collaborate in a cool way.
yeah.
But I mean, there are those who might have tuned in or who are going to listen later who are interested in like the bread and butter medicine
Oh yeah,
kind of piece. And
sure,
we didn't talk about addiction medicine. So maybe we can touch on that a little bit and we'll
sure.
take one or two more questions if there's any more questions.
Yeah,
But
I saw someone had a question about did I read Die with Zero? Interestingly, I actually featured that book. So if you go on my Instagram,
oh,
I have this highlights, and then under
okay.
highlights, it's called
Mm-hmm.
books, and that's where I review books that are financial books or career related
Mm-hmm.
books. Like, there's one called like How to Win Friends and Gain Influence or something like Influence Friends. I don't remember the exact title, but that was one of the books I reviewed. Die with Zero was actually one of the books I reviewed as well, and I
Oh.
think it's very relevant to a career in medicine.
Can
Um,
you talk, can you just mention that I'm not familiar with that
yeah,
book. So yeah.
so dying with zero is kind of thinking about a lot of the times we try to save up so much money that at the end of our life we have like millions of dollars, but we don't have enough time in our life to spend it anymore because we're near the end of our
Oh,
life. So
right, 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 right.
it kind of is nice because it kind of teaches you how to distribute that spending over the course of your life.
I see.
So what my biggest takeaway from that was actually, as someone who is a young philanthropist, like on my Instagram, you'll see that I'm constantly involved with different charitable galas or charitable initiatives. And
Mm.
the reason why I started donating money early on, when I'm still young, is because when I worked for Habitat for Humanity, like when I was a volunteer with them on their board, someone
Mm,
left Habitat for Humanity $700,000. And
mm.
we never got to thank them for it because they had already passed away.
Ah,
So they had left $700,000 to several different charities, including Habitat. And we really wanted to show them our appreciation. But by the time they donated, it was gone. So
mm,
right now, when I'm donating, I might not be able to donate like a $700,000 all at once. That's quite a large sum of money.
right.
But what I can do is donate smaller amounts such
Mm,
that in the hands of the charity, it compounds over time. So maybe
right.
let's say I donated $10,000, right? Um, from that conference that I started.
Hmm.
And right now, like I'm in my 30s, I'm 31. And so in the hands of that charity invested over many, many years, let's say by the time I'm 70, that charity would have probably made 500,000, 700,000
Right,
just from that initial investment,
right,
just the
right.
power of compounding.
Yes, yeah.
So while I may not be able to donate such a huge amount, in a way it's kind of good because I actually get to see the impact early. Like I
Of your
got to see
contribution.
exactly, I got to meet the family who got a new home. I got to
Right.
hand them their keys and they even gave me like their little artwork of their house that they drew.
Ah.
So just seeing that early in my life instead of by the time I'm dead and then not being able to see that at all, just seeing the impact that my money has on people early on
That's
is very meaningful to me.
okay. Doc
So
Naps.
that was the takeaway from that Die with Zero book. Sorry,
I
now you can
love that. And
now you
giving and
yeah,
philanthropy. Doc Napster saying great session. Thank
yeah.
you. So now we can get into a little bit of addiction medicine. Just if
Sure.
you want to tell folks, because you're in the clinic right now. Like this
Yes.
is hashtag
So
like
this
real
is
life,
actually
right?
my family medicine
Okay.
clinic because I do 2 days of family medicine. The other days I'm in addiction medicine. But how I got into addiction medicine is a pretty unique story that I hope maybe would persuade more people to go into addictions. So basically, in first year of medical school, I had always been interested in homeless health because of my own background,
Mm,
very closely with homeless shelters, right?
yeah.
And so I worked in the Imagine Clinic when I was a first year med student, and the Imagine Clinic is still there. Like you can still be involved as a medical student. And
Hmm.
this is a low barrier clinic for people without OHIP, people who are refugees, people who are homeless.
Okay.
And then so I thought I would go into homeless health or something related to that. And then I kept doing health of the homeless electives with ICHA, which is Inner City Health Associates, in my third
Hmm.
year. In my fourth year, I did the health of the homeless elective. And I even worked at Shelter Health Network in Hamilton as well, where they have a really big homeless population too.
Hmm.
And then I started, because during medical school, I did a master's with the business school and with public policy school as well. As part of that master's, I got a chance to do like a 3 month stint in any location. Some people can do it globally, like global health, but I chose to do mine at Boston Healthcare for the Homeless.
Mm,
And so when I was in
mm.
Boston, I got placed with their outreach program and specifically their addictions outreach program. So at night, we would drive in a van to distribute like safe injection supplies.
Oh,
We would go
wow.
into the shelters to help with addictions. And in the United States, addictions is a fellowship. So it's like you do 3 years of internal medicine and then you
Mm.
do 2 years of addiction medicine, just like you would do like with gastro or
Right, right.
cardio,
Yeah,
things
yeah.
like that, right? But for them, it was like a subspecialty. Whereas in Canada, you can enter addictions without having to go into that specialty. Like you could just
Yeah.
do family medicine and then be an addictions doctor, which is what I did. Or you could
Mm.
do something called a +1,
Hmm.
which is kind of like a fellowship
Yeah.
year, and that will also get you into addictions. You can even
Yeah.
go into addictions from internal medicine or psychiatry,
Yeah.
right?
In Canada, it's
So
much more open. Like I
it's
actually work
way
in nicotine
more
addictions at CAMH. So yeah,
exactly. It's
yeah.
way more open.
Yeah.
And at the time when it was also the first year of the Trump presidency, and at this time, it was really interesting because there were so many marches going on. Like in Canada, we would only hear about this on Twitter or
Mm.
in the news, but in the States, you were living it. So there was like the women's march that you were seeing like in the news,
Yes,
but
I
you were
remember.
like there, you were actually there. And then I was part of a march called March for Our Lives because 1 month into my time in the States, there was a shooting at Marjorie
Mm.
Stoneman Douglas. And then even in our
Mm.
clinic, we had experienced someone bringing in a gun and we had to learn about, putting the chair at the door, hiding under the
Oh,
table. We had to have
wow.
those classes. And in Canada, we never had that because,
Mm.
you know, the
It's
gun issue
rare
is
here.
not an
Yeah.
issue here, right?
Well, guns are an
Yeah.
issue here in certain
But not
neighborhoods,
like
certainly, but not like in
exactly
the
in the
clinic in the
States.
States.
Yeah.
Yes.
Like it
Yeah.
wouldn't be like someone
Yeah.
bringing a gun into clinic, right?
Yeah.
So,
That's
and
rare
in the
here.
States, like when we go into the homeless shelters, we actually have to put our bag through a metal detector,
Mm.
like at the airport
Oh,
as
wow.
well. So it's very different environment working in the
Mm.
States than here. And a lot of doctors, when they found out I was Canadian, they were like, oh, you know, I would love to practice in Canada doing addiction medicine. Like they were asking me about immigrating to Canada and stuff. But in the
Wow.
end, they actually didn't because of their patients. Like they
Right.
told me that, you know, they felt bad leaving their patients, and that their patients relied on them for their
Yeah.
care. And I
That's a
also even
beautiful
got
dedication.
exactly.
And sorry, I'm just gonna jump in. I'm
Yeah.
just gonna wonder, so that experience, because there's some pros and some cons. You're seeing
Hmm.
the passion of, your supervisors, the physicians, but you're also
Yeah.
seeing a lot of, you know what I mean? Like you said, like there's the gun violence in the
Yeah.
clinic. Like that might scare somebody away from addiction. So what
Yeah.
about it resonated with you, you think, like, or
I
helped
think it's because of
reinforce
the
it?
response, right? Like people took responsibility. Like it
Right.
wasn't
Okay.
like the higher ups in the clinic was just like, okay, you guys are still forced to work, right?
Mm,
Like they improved things when they found that this happened. Like they put in the metal detectors, they put in extra security. And so they try to foster an environment where you felt safer. And then they had you take these like aggression, you know, trying to those kind of classes where you learned about how to de-escalate things and things like that. So
okay.
they really took that seriously. So and I think you felt heard, right? And then
Yes.
the other thing was like a lot of the doctors there were very strong advocates too, because when I was involved with March for Our Lives, helping with the medic team, you saw the enormous passion like some of the parents have for protecting their kids in schools. You saw the
Mm,
passion the doctors had. And then at the time, like it seemed it was very political as well. It seemed way more political than it was here in Canada.
mm.
Like these doctors were also getting involved politically at the march. I also met with Senator Warren as well. Someone from the Kennedy family was there too.
Wow.
So a lot of people from politics were getting involved. The doctors were getting involved. It seemed like a very united front to
Yeah.
try to improve safety in schools.
It's inspiring. Okay.
Yeah, I felt the passion to be very inspiring to see these doctors do this. And I really admired their character. Like they were all very
Right.
noble in character. And so at the time, I was also, since I was in fourth year medical school, I was also making my rank list. And so
Yeah.
that's why I decided to rank family medicine first, because I knew that family medicine was the shortest path into
To
addictions.
addiction
And that's what
medicine.
I wanted to do. And even in residency, I did a ton of electives and selectives in addictions, such that I
Mm.
felt comfortable doing it without having to do an extra fellowship. So I just went straight
Right.
into addiction medicine after that.
I think it's really a beautiful thing. First of all, I mean, you talked about how your parents had to leave the neighborhood you were in because there were like used syringes on the floor.
Yeah.
And then you turn like full circle working around issues of poverty and also working in addiction medicine, like helping the people who would be the people
Yeah.
who have the syringes on the floor. And I think that is beautiful. I think the piece you talk about, seeing the passion in those doctors is the thing, because when I spoke to, like Dr. Aisha Lofters, and I said, during this
Yes.
pandemic, what makes you able to like keep going? And she talked about like the passion in the Black community leaders and things like that. And I think hopefully people watching now are inspired by you and your passion. I'm gonna see if there's like maybe just like last call for questions, and then we might wrap it up unless you have something. So think, Dr. Zhou, Stephanie, if there's one last thing or one last message you want to share with our viewers, and I'm just gonna do like one last call. This is it. We've got Dr. Stephanie Zhou. Do you folks
Yeah.
have any questions for her? Because we're
Luckily,
gonna wrap
I'm
up.
pretty active on Instagram, so I regularly have students just send me a DM.
Perfect.
Sometimes I might not be able to respond like immediately, but I usually try to actually get through my DMs because, well, I get a lot of DMs from students, but I usually will try to. And then even if people have questions, because I'm on YouTube, Breaking Bad Debt, and I
Mm-hmm.
post a lot of my lectures, about financial literacy, personal finance. I actually, one of my videos is really popular right now. It's tuition tax credits because it's
Oh,
tax season. So all these
right.
students trying to figure out like how they can claim their tuition tax credits to help lower their tax. Or
Y'all need to
if you
check
have a
that out.
yeah,
Okay.
if you have a
Sorry.
family member and you aren't really paying much taxes as a student, you can even give your tuition tax credit to a family member to help them reduce their taxes too. So you can transfer $5,000 in tuition tax credits to a family member, and they can also claim it on their taxes as well.
That's
So
fantastic.
yeah, so I have a lot of videos related to that, and I find a lot of students and residents, they will post a comment on the video,
Hmm.
and that way when I respond, other people watching the video can see the comment too, so they get the answer as well. So that's another way to reach me. I'm very easily searchable actually.
That is
Yeah,
awesome. And yeah, so I mean, Breaking Bad Debt on YouTube. So check it out and check out this like student
yeah,
tax credit. That's fantastic.
student
And
tax
or
credits
on Instagram here with at Breaking Bad Debt. But Dr. Zhao, I really appreciate you coming on here. I was thinking that when we met, you were a medical student, but actually you're a resident. You had started the residency
oh, when we
and you were
met
part of like
the
the
first time.
EDI, yeah, the EDI
Yeah,
action plan, I think. Because
yes,
earlier before you tuned in, I was like, oh, I think it was when you're, but it was you were a resident, so I'll correct that.
yeah,
But it's been fantastic to follow your career in this way, and also just to hear like now, speak with you and find out about all the amazing stuff that you're doing. So at least we have this recorded. People can
for
check it
sure.
out, and yeah, I just want to thank you for being a guest on Health Caring Differently, and thank you for your actual work of health
Thanks.
caring
Yeah.
differently.
Yeah, and it's such a great initiative that you're coming up with, because I feel like when I was trying to apply to medical school, I never really knew that there were so many unique careers in medicine. And it's really great that you're really featuring a diverse group of people, not just diverse in terms of like ethnic background, in terms of where they're coming from, but also in terms of what they're doing right now for their careers as well. So I see a lot of hearts going to Dr. O.
Oh, thank you. I think
Yeah,
for both of us, but yes, we appreciate the hearts, we appreciate the love, and we'll see you next Tuesday. So my guest will be a nurse researcher, Indigenous nurse researcher, KD King, who does phenomenal work around gender issues, sexual health, and Indigenous health. So that's what we'll have next Tuesday. Otherwise, please do continue to follow us and like check our not our Instagram, but our website for healthcaringdifferently.com to join on the newsletter. Actually, Dr. Zhao, you gave us a lot of resources that we're going to add to the newsletter tonight. So
fantastic.
thank you so,
Wonderful.
so much. All
All
right. Good night,
right.
everyone.
Thanks, everyone.
Bye.
Have a good night.
Bye.